We have been involved in the clinical studies for many, many years. As Mario said, we were involved in the macular study. Since then, we have been working very hard for more than 2 decades in clinical trials. We have been involved in several AMD trials, diabetic trials, and also glaucoma, dry eye, and recently we have been involved in other type of clinical trials. We've also been doing characterization of the diseases, which are very important for us. We don't have that data in Colombia. For now, we know that geographic atrophy, we just finished the data, is present in people older than 80, mostly women. More than 60% of the population is women. And also the visual acuity is 2200 at the presentation. So we are covering this disease very late in life. So probably that's a very good point, because we have a very large population in the studies that we participated for geographic atrophy. Also, AMD is I was planning to show the data that we have from Medellin, Cali, and Barranquilla. AMD is prevalent for the macular diseases rather than diabetic and vein occlusions. So 54% about of the population in the studies is AMD, about 30% DME, and about 35 to 40 vein occlusions. So those are the most prevalent macular diseases in our centers. We have 5 centers, Medellin, 2 centers, Cali 1, Barranquilla 1, and Bogota 1 center. Bogota is 10 million people population, as was explained by the Brazilian colleagues. Medellin is 4 million, Barranquilla is about 2 million, and Cali is about 3 to 4 million populations. So very large cities. Our centers are private, but we see patients that belong to the health system. To explain shortly, our health system consists that the most people is mandatory to belong to a private insurance. This is basic insurance, but it covers everything in our health system. Corneal transplant, retinal diseases, injections. You can have whatever hip replacement, whatever you need, cancer is covered by this private insurance. You pay monthly for these insurances. Also, you can have private insurances, which are not mandatory, but it covers about 1 million people. But our health system covers about 95% of the population. So most of the people are now not covered, because most of them broke down recently because of the government decisions. So that's a good opportunity for us to have people that can be involved in the studies, because they have no health health system to cover them at the moment. And finally, our centers have been standardized and also have been approved in our country that it needs approval. And the regulatory issues may take 3 to 6 months right now. We hope it may improve if we change government in the next 2 months.